welcome everybody again to the Urban Outcast. I am your host, the Outcast, Mark Urban. Today, we've got an interesting topic, one that I kind of got drawn into unexpectedly while I was cruising around on a local Facebook page here called the Lynden Neighbors, and it's the topic of fluoride in our water. I've kind of been one of those guys that's a little more of a hands-off. I'm not personally for it per se. I don't do it. I drink filtered water, and for me, it's kind of more of it's not so much the what, but the why. And while I was on there, discovered lots of opinions. There's a vote coming up pretty soon in Lynden about whether or not we should have fluoride in our water, and lots of opinions, lots of very passionate opinions on both sides. There's definitely a movement that's against it, and I've kind of been propelled into this and done a little bit of research myself to kind of further educate myself, but I am by no means an expert. But today I have somebody who at least is somewhat more of an expert on the fluoride pro side, and I came across this gentleman when I was looking on the page, and he posted some videos saying, hey, fluoride's not so bad, and here's why. I'm not convinced. But you know what? He reached out to me and said, hey, let's go have lunch. And I said, absolutely. And, I was fortunate enough to go have lunch with him. By the way, great guy. I like the guy already. I think there's a lot of things we agree on, as we discussed. Not sure this is one of them. But I said, hey, would you like to do a podcast with me? Come on the show. And, I'm going to just read to you and go over some of the things your detractors say. But this is kind of his opportunity to have somebody press him a little bit and talk about these things. And so without further ado, I'm pleased to have with me today, Mr. Jonathan Henry. Welcome, sir.
Awesome.
How are you?
I'm doing good.
Thanks so much for coming. I appreciate it.
It's a crazy topic right now. It's a pretty heated debate, and that Lynden Neighbors Facebook page has 7,000 Lyndenites.
Is it really 7? I haven't even looked at the number yet. Is it up to 7,000? Yeah. Man, it's catching that page I'm on Bellingham, that one with the naughty word in it. Bellingham's gone to bleep.
Mm-hmm. So my wife's family's all from Lynden. They moved to Lynden in the 30s or 40s, and my wife convinced me. She said, when you get out of dental school, we're living in Lynden. So,
well, that's what I was going to say. I was, by the way, before we get into it, I was going to say, why don't you tell us a little bit about you, where you're from, and your background and what you do. Awesome.
I grew up in Kelso Longview, down south by Vancouver. It's a small town, paper mill town. I was an athlete in high school. I did football and track. I knew I wanted to go to college. I didn't really know where. My mom and dad are from Boise. They're Boise State football fanatics. I was born in Boise. I'm a small town guy.
What's the town you're from again? Sorry.
Kelso.
Kelso. And how many people are in there? How big is Kelso?
It's probably about as big as Ferndale. I'm not sure right now. Kelso, Longview together, I know, is smaller than Bellingham.
Okay. Yeah.
But together, they're two towns that are side by side.
Gotcha.
They have 3 high schools.
Okay.
The industry there is all paper mills.
Do they have fluoride in their water?
Yes.
Okay. Anyway.
Sure. Yeah. I came up here to Bellingham because my dad worked for an outfit that came and worked up at the oil refineries, and he was spending a lot of time up in Bellingham, and that's kind of how I got aware of it. Came up here to go to Western, and the rest is history. My wife went to Western. That's how we met.
Is your wife, did you say she's from Lynden?
Yeah. She was born here. She's went to Lynden High School.
Does she play Dutch bingos? Has she got a Dutch?
Oh, yeah.
Okay, great. Yeah,
Cousins,
I love that.
You never know who's who. Yeah.
You never know when an episode of Dutch bingo is going to break out. That's always entertaining.
Oh, yeah.
You learn a lot about who's who real quick.
Yep. My wife's grandpa worked for the Lynden Tribune for a long time. And they're just local.
So you went to Western, and did they have a dental program there?
No, just pre-dental, like science. I got a degree in biology, cell biology, and a minor in chem. So just get you prepared to apply for dental school. You got to have all that science, basic background in science. Mm-hmm. So my undergrad degree got a Bachelor of Science in cellular biology and a minor in chemistry. And I was trying to get a minor in business also because my mom and dad are business people, and they always said, someday you're going to own your own practice. You got to know accounting. You got to know business basics. So I got a lot of stuff from them, just talking to them business wise.
So you kind of knew you wanted to go. What propelled you into dentistry, or what made you? And then after Western, where did you go from there to get your degree?
Yeah. We had a dentist in my hometown that was our family dentist, and he was instrumental in my life. He was a mentor. He kind of convinced me to look at it, and he said, "I think you'd be a good dentist." He said, he said, "You got a good head on your shoulders. You like helping people. You're
He
smart."
didn't say you got great teeth?
No, well, he did. I got my braces in 5th grade, and he was my dentist. He said the orthodontist did a great job, So he's just such a positive guy and a leader, and he was a sports guy too. He ran track, and we had a lot in common, and he just sort of taught me how to do it, and I spent time in his office observing and just hanging out. And then when I applied to dental school, he helped me get in. He wrote me a letter of recommendation, and you just got to have that network of people to help you along the way.
And where's dental school at?
I went to Pittsburgh, Pennsylvania, University of Pittsburgh, Pitt Panthers.
Okay.
I applied at lots of places. When you're applying to dental school, you kind of have to hit a certain number of classes and requirements that they have a list of admissions requirements, and Pittsburgh was just one of them where I already checked off all the boxes. Okay. So I applied to UW, I applied to Marquette, Creighton, tons of places. Because when you're trying to get into dental school, it's really hard. It's competitive. You got to just put yourself out there. Yeah. So you get interviewed, and then you get like essays, and you got all these test scores, and there's so much that goes into it. And when I went to Pittsburgh, they interviewed me right away. They offered me a spot right away. So I said, okay, that's cool. It's nice to get accepted. And then I was waiting to hear back from the University of Washington. I kind of assumed I'd had a shoe in at the University of Washington because I'm from Washington, but they never ended up accepting me. So I ended up saying, all right, we're going to Pittsburgh, babe. And me and my wife, we got married, and a month later we moved to Pittsburgh.
Wow.
And then she's been with me ever since. I was broke. She had a job. I was going to school.
Yeah. Well,
and then we had our first kid in Pittsburgh, and then we moved back here.
Yeah. So, and what was her schooling for?
She went to Western. She got a degree in finance.
Okay. Great.
And
so she does the money in the household, I'm assuming.
Well, she lets me do the
she
budget.
Lets you, but okay. I like how you put that. She lets you.
I do the budget.
It's a wise husband right there, guys.
She spends whatever.
We might get some marital counseling out of this podcast as well. Yeah. Usually there's always a little touch of that at some point.
Right.
From wise men anyway.
Yeah.
So
I'm not ashamed to admit it.
No. Well, between any great man is a even better woman.
Oh, I'm so blessed. Oh my God, she's incredible.
That's awesome, dude. Congratulations.
Yeah. Thanks.
And again, how long you guys been together?
Married 17 years this summer.
This summer?
Yeah.
What's the date? What's the anniversary?
July 14th.
July 14th. All right.
Yeah.
We'll have to blow you up.
Oh,
with some, hey, congratulations.
Thanks.
Are you a Facebook guy at all, or besides just,
Yep.
Yeah. So, yeah. Okay. Yeah.
And I just somebody at work showed me how to Instagram. So I've got a little Instagram, but I just put stuff on there with like me playing golf and like stupid shit.
Well, I tell you, Facebook's a bittersweet thing for me. I mean, I do it partially for this. I'm a musician. I'm a firearms instructor. It's a bitter kind of a necessary means to an end. Mm-hmm. If I could do without it, I would. But Instagram, TikTok, I'm reluctant, but I kind of need to get into that stuff just because I have friends that do it, and they say, look, my big thing, not to digress, but is the whole China spying on us. Is like, dude, that ship sailed a long time ago. Every app in your phone is spying on you, so get over it. And Yeah. So then, how long have you been a dentist?
Graduated from Pitt in 2011. So this May will be 13 years.
Okay. Yep. So where's your business at right now? What currently do you work for yourself, or do you work for an organization? Or?
It's a big organization. It's a community health clinic, downtown Bellingham. We have 3 locations. We have one in downtown Bellingham. We have a second one in downtown Bellingham that's all kids. And then we have Ferndale. They just built a pretty nice facility on Portal Way. So,
and do you bounce back and forth, or?
Nope, I'm in the downtown, the main downtown adult dentist clinic. We see 25 and older. The kids clinic sees 25 and under, And then the Ferndale office has a mix, like anybody, all ages. So I do adults,
What's the age group on Bellingham?
25 and up.
25 and up.
Yeah.
Okay. Interesting.
So we get our main base of patients is Medicaid, low income, everybody who's covered by different government plans, different state of Washington, different insurance plans or different groups that have coverage for some reason. And so we see a lot of low income. We have a sliding fee scale, so you can pay for our services. We have medical, dental, behavioral health, and pharmacy. I'm just in the dental department.
So what does that entail? That's not like any kind of surgeries or anything, right? It's just maintenance, or
we do cleanings, we do checkups, we do emergency visits, we do extractions, we pull wisdom teeth, we do root canals, we do fillings, we do anything for kids. Our kids clinic does baby teeth all day. So we do practically everything except high-end stuff. We don't do implants. We don't do dentures. We don't do like a normal crown. We don't really do that. We just do kind of the basic stuff that's covered by the Medicaid plan.
Okay.
Yeah.
And so you're the only dentist, or is there more than you?
In my site, we have 5.
Okay.
And 3 dental hygienists. And we have about 15 dentists total and 7 or 8 hygienists.
Dental hygiene, man. I tell you what,
we have 70 people in the dental.
We're here to debate fluoride, but
yeah.
I just want to say, God bless you, sir, because I couldn't work in somebody's dirty mouth. So you got a special gift, and especially these dental hygienists. I mean,
oh yeah,
you got to have the face mask. And you wear. I mean, I'm not a big mask guy at all. That's a whole other topic, but
sure.
I'd be wearing one for sure, man. Just
yeah, we have to. It's all PPE.
Yeah.
Safety glasses, masks,
get your
gloves,
hazmat suit on. Some
gowns.
of these people coming in, I imagine.
Yeah.
I know you can't talk about it, but I can. I got all kinds of jokes, man.
Sure.
Yeah, you get the guy with like 3 teeth. It's like, well, this is going to be fast. I can imagine.
It's a job. I like it.
Well, we need that. We need that.
Yeah.
We need doctors. We need it's great. Yeah. I mean, it's just not that and feet. I can't stand feet. And then, of course, the worst one in the world would probably be either a proctologist.
Yeah.
I mean, come
Urology.
on.
Yeah.
You're surrounded by assholes all day. I mean, literally. So that's a little.
That's why I didn't go into medicine. I did not have any interest in medicine, but
yeah.
That's it.
That makes me think about another question as to what kind of, or do you get any kind of medical, or is there any kind of crossover there at all, or is dental totally separate from medical per se?
You mean like my education? Or
yeah, right. I mean, I guess I would imagine you go through some of the same things doctors do, at least studying human anatomy and biology, right?
Oh yeah, yep. All the basic science, biology, biochem, organic chemistry, regular chemistry. At Western, I learned about genomics, which is a newer field that's all about genetics and how your DNA interacts with things and the way your body turns on your DNA, turns off your DNA, stuff like that, how we study that, the human genome. Mm-hmm. So that was all pretty cool. But then once you go to dental school, you learn about anatomy, and we did the whole body. We learned about bones, we learned about tissues, we learned about teeth, really in depth, obviously. Neck, up, everything. We had to do cadavers, dissecting cadavers. We basically learned about...
No kidding.
From here up, we had to dissect it on a human body. So we're in the cadaver lab.
Give me an example of what what do you dissect? Are you looking at the facial structure too? Or is this all teeth?
Everything face, everything.
Really?
Took the brain out, all that.
Wow.
Yeah.
That's a cool experience.
Oh, it was cool, but it was hard.
Was it? Yeah, because that was a real person.
Yeah, people donate their body to the school, and then we have students that just get to learn. So, yeah.
Wow.
That's legit. I mean,
that is, yeah.
Cranial nerves, all the blood vessels, all the muscles, all the bones. Well,
that would make sense. You need to know that because that's all tied into nerves and things that are in your jaw and your teeth. And I do believe, dental health is also a big part of your entire body because you're getting things absorbed into your mouth, into your bloodstream. And, I know there's studies and you probably agree with this, that, poor health and poor diet and poor things you eat, you got a dirty mouth, you might have a dirty body.
Oh, totally. It's all connected. The especially the gum, when you have inflammation in your body, when you have swelling, when you have infection, when you have bacteria in your gums, those bacteria can get in your bloodstream, go to your heart,
Right.
and it increases your risk of heart problems. Arteries, plaques in your arteries, diabetes. It's all related. Your body's ability to heal. So yeah, we tell our patients, you got to get your gum health good. You got to get your cavities. You can't let your cavities lead to infections.
So you care about health.
Oh, it's intimately
Health is
connected. Oh yeah.
Health is important to you.
Oh
yeah.
We have to know everybody's medications. We have to know their health history. We have to know their cardiac status. I'm doing surgery. I'm numbing somebody up, pulling out a tooth. I'm cutting a body part out of somebody's head.
Right.
And I got to know how it's going to heal. I got to know how to suture. I got to know how to avoid post-op complications. So yeah, it's a general dentist is, I like to say we're brothers with the plastic surgeon. Like we do things we cut body parts off. We make people look nice. A lot of what we do is elective. You want to make your smile look good. You do braces. So I say we're similar to a plastic surgeon.
Okay. Well, that kind of ties into, my first, point. You and I kind of talked a little bit before, for me with the whole fluoride issue, is about choice. And it's not so much the what, it's the why. Why must we have it in our water? And this is scientific, I've looked it up. If the best application for fluoride is topical, whether it's coming in, getting, a fluoride treatment or using fluoride toothpaste, then why risk the chance? Because there's lots of studies out there, I've been looking at them, that show that this is a toxic substance. Why risk the chance of ingesting it systemically into our bloodstream, crossing the blood-brain barrier, potentially causing other side effects, which now, as I'm doing research, is finding out there is new science, there is new research. There's even a big lawsuit going on showing that there is some of these effects. So why take that risk?
Now we're getting into toxicology.
Oh, yeah.
Toxicology is a science of what makes a substance poisonous, at what level, when you ingest something, is it fine? As you increase it, it starts to get dangerous. A lot of those new studies are talking about IQs, are talking about thyroids, are talking about bone cancer, all kinds of issues. What matters is how much concentration. Once you hit a point, your body can't metabolize this stuff. So it starts to accumulate in your brain or your tissues, and then you can't pee it out fast enough, and you're going to have problems. But that's true with sugar, salt, magnesium, everything on earth. If you have too much, your body can't metabolize it. Below the range, when we're in the safe range, and it's a range, it's from 0 to a certain number of parts per million in the drinking water. And human beings consume anywhere from 0 to 10 parts per million all over the planet Earth. We know because in India, these kids grow up with weird skeletal deformities because they're drinking water that has way too much fluoride. Dangerous, horrible. They're like arthritis, like their bones are all messed up.
Is that fluorosis?
Yes.
Yeah.
Skeletal fluorosis. So we know what level is okay and we know what level is harmful. And the United States scientists have dug into that for decades. And so that's what they teach us in dental school and medical school. Everybody can learn about it. As a doctor, you know what the toxicology says. We have a therapeutic range of every medicine. You have a good range that is helpful. Then once you get too much, you get dangerous.
So you said we know what we study this. We know what the levels are, but and you said you study this through the Dental Association in your training.
Right.
Your retractors would say that you've been indoctrinated by the system, and you filter everything through that system, and you most likely do not look at research outside of the system and weigh that in the balance. What say you?
As part of my dental school curriculum, we had a class only about how to read a research paper, how to see, is this research biased at all? Is this research coming to a conclusion based on the data that it's presenting? is this research applicable to dentistry at all? Is this research funded by somebody who has an agenda? Is this research peer reviewed to the level? Does it coordinate with other studies and make sense as a whole with what we know? So we had an entire semester of all of that.
So, but what does that mean though? Because my experience, other than I'm finding doctors and dentists who would disagree in the sense that a lot of that's archaic, outdated data, and there's new data coming in. These guys have degree. In fact, one of them is a biological dentist who I just watched a video. Would totally disagree. How does this cavern between you and him happen? And your detractors would say it's because you're not actually taking the time to look at what he's saying. So what I'm saying is what evidence is sufficient for you? What is the litmus test? Where's your threshold? How many studies do I show you 5? Do I show you 10? Because for me, there's, peer-reviewed, everything you said I agree with, but I think that an actual doctor and dentist's opinion from experience also is valid testimony in a court of law. And my brain looks at everything like it's a court of law, right?
Absolutely.
And so when I hear more and more growing, about the potential toxicity of fluoride and the effects of it, my question again, bringing it back around, is what is the litmus test? How much information, what kind of information would convince you that, I think maybe we should just leave it out of water?
So if you have another professional like me who comes along and says, I have a study, let's look at this study. This study is saying fluoride's bad. And this study was published in 2021. It's really new. I would look at it and I would say, okay, what level, what concentration of fluoride is that study talking about? And if it's not talking about below 1.5 parts per million, I'm going to say then it's not relevant to the United States, because above 1.5 parts per million, the United States government agrees there is harm, there is a potential, we need to study that level more. Below 1.5, there has never been evidence that it's harming anybody. And that's the level we have in the United States. And that's why our government, all these agencies that do this type of peer review, that's the first step. If they're not talking about a relevant toxicity level, then it doesn't matter to Lynden, Washington, because we don't have above 1.5. It'd be like talking about, is sugar dangerous if I eat 10,000 bags of Skittles? Of course it is, but we never do that. It's irrelevant.
Are you familiar with the National Toxicology Program?
Oh, yeah, I read that whole thing.
Yeah.
Yep.
The lawsuit going on right now?
I've been following that because I want to see if the judge that's doing that they actually brought this before a judge, not just a panel of
It's been going on for 7 years, and it's finally, and he wanted to see what the results are.
Yeah, it's a big deal.
Yeah, no, it is. Again, but bringing it back then around is, for me, again, it's not the microdose, it's the cumulative effect. And I think that varies. And I don't think that any 1 or 2 studies can definitely particularly narrow that down. One guy drinks 1 glass of water.
Yep.
Another guy drinks 2 gallons a day, plus it's in his tea. It's in a lot of the juices and pops and things that they ingest also has fluoride in it. So now we're taking taxpayer dollars, putting something that's potentially toxic, depending on the levels and individual biochemistry, individuals that could potentially be dangerous. Why take the risk? Why not just give us clean, pH balanced water and let us decide whether or not, because fluoride is not an essential nutrient. It's not essential to our body at all. It's not. I mean, I've done the research. I mean, you can tell me it is. I'd like to see the proof of that. It is, the only reason they put chlorine in is because they have to make it potable. They have to clean it. They put, sodium and I think calcium and things to neutralize it and bring it to an alkaline pH.
Yep.
But fluoride is not a necessary nutrient. And because there is potential evidence that it can be toxic and it can be dangerous, why not just let the people decide and come in and see you for a fluoride treatment, or brush their teeth with fluoridated toothpaste, which, by the way, says do not swallow.
Yep.
So why not just let the people decide?
Well, you had a lot of different questions in there. The first one is
Sorry, I can review it. So I threw a lot at you.
the first one is fluoride a nutrient? Is it an essential nutrient? Do our bodies need it? I would say yes. We have studies that show in rodents, if you give a rodent the right amount of fluoride, their bones are stronger, their bones grow longer, and they have an improvement in their health. If you don't give them that rodent is smaller and their bone density is different. That's just bones. Your mineral in your body, fluoride is a mineral. It works with calcium. It makes things like a crystal, like a rock. So our bones and our teeth. Your teeth, if you don't ingest enough fluoride, when you're 6 months old or maybe a year old, you're going to stop breastfeeding and you're going to start drinking water. So I don't know what your thoughts are on evolution, but if you want to say human beings on planet Earth since whenever human beings appeared, we've been drinking water that comes out of the ground or comes out of a river, and it all has fluoride in it. And so when you're done breastfeeding, you have to drink water and you have to get that hydration. And we know that fluoride has been in the water. It's in the ocean. The ocean has 1.5 parts per million, pretty much all life in the ocean. So that tells me as a scientist, fluoride is a thing in nature that is normal, and our organism body uses it, knows what to do with it. We need it for healthy bones, and it helps your tooth enamel. When you start to drink that water as a baby, it makes your teeth internally, before they're growing in, it makes your enamel, that outer layer that's the hardest substance we have in our body, that fluoride integrates into that crystal, and it's there so that when that tooth grows in, you now have a layer of protection. And it's the hardest, healthiest that it can possibly be. And that's the same way it works in sharks. I was telling you earlier, shark teeth. Sharks grow teeth, lose teeth, grow teeth, lose teeth. They have so much fluoride in their teeth, and it's amazing. It's the same crystal as humans. When I say
the shark crystal, is that what you're saying? The shark tooth is, or the crystal that? Okay,
the tooth structure at an atomic level, that fluoride is there, and it's helping to strengthen that surface. And so I believe fluoride is a nutrient. I believe it's a mineral. Excuse me, just like calcium. Your bones need it. Your teeth needs it. If you don't have enough fluoride in your diet, your teeth are going to be weaker.
Well, so, I'm finding studies and opinions by very educated people that say that's not. There's no evidence of that at all.
Really?
In fact, I got a video I can show you. There's toxicology, the potential effects for you're taking something that's potentially toxic. That's not, vitamin C. I mean, I guess if you ate enough of it, could be toxic. But I mean, fluoride. You're the first person I've heard that said fluoride's an essential part.
I wouldn't say it's essential. You can live your life and you're not going to die from a lack of fluoride, but you are going to get more cavities.
Yeah, but there's studies that show that that's not true either. There's iodine treatment, there's ozone. First of all, diet. If you eat a healthy diet, it doesn't matter how much fluoride you have, you're still going to get cavities. I know people that had fluoride treatments their entire life and have tons of cavities. And a lot of that is biology and diet.
It's the bacteria in their mouth.
Right.
There's
has
so
nothing
many
to do with
things.
fluoride, though.
No, so many things play into it.
Oh, absolutely. But that's what I want to discuss with you. So when I talk about this doctor I just watched, this dentist, he's a biological dentist. He's been one for 30 years. He says he's been treating his patients. He says, I have no higher rate of fluoride or of cavities than anyone else. So I look at things like that and I listen to that and I go, again, it brings me back to why must we government mandate putting it in our water when there are potential dangers? Why not just let us decide? Why not? And the other thing too is what's the quality of the fluoride we're getting? Fluoride is a waste byproduct from fertilizer. You follow the money. Okay. There's a lot of people that stand to gain money off of that.
You can, when I hear people say that, they say it's toxic waste. They say we can't dispose of it.
I'm not saying we can't process it, but yeah.
So I would say it's a mineral. It comes out of the dirt. When the fertilizer company gets a truckload of dirt, they take it to their fertilizer plant. You're going to have all the stuff that you want, right? All the nutrient, all the nitrogen, whatever you're using for your fertilizer, sulfur, whatever, phosphorus. But you're also going to get all the other stuff that's in the dirt, like fluoride. And so when they break this stuff down and they make a product that they know the chemistry and they're like, okay, this is good for our fertilizer, but we're left over with all this other stuff. it doesn't mean it's a toxic waste. They just use that in a different way. And they use the fluoride for lots of other chemical processes.
But it's not even sodium chloride. It's hydrofluorosilicic acid.
Hydrofluorosilicic acid. Yeah.
Which is, that's not the same that's in your toothpaste.
Right. Because the stuff in your toothpaste is designed to dissolve in your saliva.
Mm-hmm.
You brush with it and you spit it out. Hydrofluorosilicic acid is the perfect fluoride version to dissolve in H2O. It has 6 fluorides and it has 1 silicon in the middle that holds the fluoride together. When you put that in water, all you're left with is fluoride floating around, and you're left with 1 silicon atom that interacts with oxygen, and that becomes silica, which is sand. And then the sand falls to the bottom of the pool, and the
Well, we have silica and everything. I mean,
Silica,
that's
that's
a hill I'm not willing to die on anyway. I have it in half of our products. They put that in just because it helps get it through your system and
So
stuff.
the hydrofluorosilicic acid is a chemical compound. Before you dissolve it in water, it's kind of a scary sounding name, but when you put it in the water, it just becomes fluoride in the water.
Again, systemically ingesting it, breaking the blood-brain barrier, getting it into our system, your body can only process so much of that.
Yep.
In fact, 50% of it stays in your body. So you get this, again, I'm bringing back to the potential for the cumulative effect. There's new evidence, there's new studies, like you said, this lawsuit coming out. One of the things as I watched that video is you notice the stuff that was suppressed by the FDA and our government. In fact, our Surgeon General, was the new transgender Surgeon General, said we need to squash that. Why would they hide these things? They don't want these newer studies out there. My theory about that is, and this is mine, it's because there's people who stand to lose money. Follow the money. Your constituents who are in the fluoride business, the fertilizer business, whatever, that make money are the ones that, it's that way in politics, it's with any product, okay? And you follow the money, they stand to lose constituents, they stand to lose votes, they stand to lose money. Now, maybe that's a big conspiracy theory, but you have to agree that the government hides stuff from us.
Here's what I understand about that whole thing. You have a working group that is tasked with looking at fluoride, and I believe they labeled their report neurotoxicity or cognitive issues with fluoride. And they said, we're going to look at hundreds of studies, all the recent data. We're going to see what level of fluoride is bad and what do the studies show. And then this group, they wrote out their paper, and then a second group peer reviews it. And the second group said, okay, this is looking okay, but we need you to tweak a few things because people are going to read this and they're going to say, you're saying fluoride is bad no matter what, and that's going to tell people fluoride in the water is bad. And we want you to make clear that you're not saying fluoride in the water is bad. You're just saying fluoride above a certain level is bad. And so they had this government group where you got 2 groups of people. One person did the work, one person's reviewing the work to make sure their conclusions are okay. And then you've got the Health and Human Services lady, like you just said. It's her job to make sure the government puts out valid stuff that is legit and reliable. And she said, you can't release that because that's not good enough, and we want to make sure we get it right. That's my take on the whole thing. She's not covering it up. She's trying to ensure
Well, the language
integrity.
they used, though, was very emotionally charged. It was like, we've got to get on top of this. This can't be released yet. This has got to be, and it's like, well, and they were talking about just the fact that there was a study being done, and when things were being requested, I'd have to go back and look at it. But in the video, they highlight it. This lawyer is going through this. This is evidence of the little bit of government kind of going, oh, we got to cover our butts, and you may be right. Maybe it's just they don't want it. But, the people who already are sensitive to fluoride potential toxicity look at that, and of course they're going to go, okay, well, that's interesting. What are they trying to hide?
Right.
But I don't know, maybe you're right,
As a doctor who has to rely on the government for my guidelines, I don't want them to go too fast. I want them to make sure that they have peer reviewed this stuff. They have thousands of PhDs, academics, people who get paid a lot more than I do to know the science, and they're not going to put something out there that could be construed to say we've been hurting our people for 70 years when that's not the conclusion that's true. So they have to have a level of integrity, and they got to make it clear. We're talking about fluoride above 1.5. We're not talking about fluoride below 1.5.
Well, in this study that I was looking at, they was saying that there's evidence. The NTP National Toxicology Program did, what was it? 62 out of 72 studies show that there is a link between fluoride levels lower than 1.5 and low IQ. So is that peer-reviewed evidence yet? Well, apparently is by the NTP. So to me, I go, okay, let's stop. And I'm not using the word indoctrination to degrade you in any way, but your detractors are going to say, the indoctrinated person is going to not look at that. For me, I look at that and go, okay, these people aren't dumb.
I've read it.
That's
I've
evidence.
looked at the whole thing.
To me, it's like, maybe we should just not put it in our water for a little while until some more of this stuff gets vetted. Because here's the problem, Jonathan, in my opinion, is we see all these people going, hey, they're smart people too. They've got doctorates. They're not dumb. There's a lot of money in lawsuits. And a lot of these people who are in this, they're not gaining anything other than they just want clean, healthy bodies, right?
Absolutely.
So they're looking at this going, we need to stop. We need to hold on a second here, because why take the risk of continuing to put something in the water that we're going to find out in another 5 years or even sooner that, okay, there is evidence this is detrimental and it is causing pineal problems and cognitive issues and thyroid issues. $6,000 a year and, what is it? 7 parts per million or 7,
0.7. Yep.
Is it really worth it? And I think that's where I go back to what is the litmus test for you to say, all right, maybe we should come in and see me. Maybe we should just take it out of our water. And correct me if I'm wrong. I'm hearing you just haven't seen enough evidence to change your mind from what the current status is. Is that correct?
Right.
Okay.
Everything that I've learned, everything from my undergrad college all the way to now, the only health concern that we have in the U.S. at the levels we have is dental enamel fluorosis, which is a color change of your enamel.
Right.
That is the only proven side effect that concerns me. Everything else happens at a much higher level, and we don't have it. We don't have it in Lynden at all.
Okay, yeah. So you truly believe, you have no dog in the hunt. There's no money, extra money for you. Your detractors would say, yeah, but you're indoctrinated. Okay, well, whether you are or not, are you open to look at alternate evidence?
Hell yeah. I do it all day.
Okay.
I look at all the newest toothpaste. I look at all the newest, any technology, any type of change that affects our industry. We do continuing education all the time. So I am absolutely open to the best practices and the modern medicine. I'm not here to just believe that the earth is flat and I'm never going to change. That's part of my job. I'm truly here to help people, and I believe if we lose the fluoride in the water that we have in Lynden, we are going to lose a protection for everybody's teeth that affects you for the rest of your life. You talk about money. Here, you might not believe it because this is a government stat, but whatever. When they calculated in the United States, for every dollar spent on fluoride in the water, it saves us $38 of dental care for each dollar.
Yeah,
We're preventing that much health care. It's a slam dunk. Economically, on the scale that we have it, 70% of America drinks fluoride water. If we took all that away, for every dollar, you're going to lose $38 of preventable health care costs.
Yeah, I would agree with your first part of that. Is I don't always trust government. I would have to see what
I figured.
Well, look, look at COVID.
I know.
COVID peeled this.
You and I agree.
I was already
COVID?
one of those guys that didn't trust half of what the government says, because follow the money. There's always a dog in the hunt somewhere. And COVID was the ultimate wake up call for some of those middle people that were like, I'm not really into conspiracies. Now they're like, okay, they forced people to wear a mask. That there's plenty of evidence that it doesn't stop COVID. They forced people to take mRNA injections that modify your DNA and have detrimental effects they're finding out now to your body, or lose your job. And so I think you do have a lot more people going, I don't trust the government because the government has lied to us so many cotton picking times. The CDC, you don't need masks. Now Fauci, oh, you do need masks. Oh, now you need 2 masks. Okay,
Right.
you know, these are supposed to be the best and the brightest.
Yep.
And you, meaning not just you, but people are saying trust the government. Government has a study on this. Well, of course, right away I'm going to be skeptical because so did the CDC about everything else that we learned with COVID. These guys are supposed to be the best and the brightest and the smartest.
Right.
Why would Anthony Fauci? I mean, we're digressing, but this ties in. This guy is supposed to be brilliant. He's been doing this stuff for years. Not know the efficacy of a mask.
Everything that happened during COVID was a very big failure in communication and public relations, and it looked horrible when we're changing guidelines. We're learning new things so quickly, and it was a deadly disease that we didn't know how bad it really was. And so everybody was scrambling. We're trying to fix it. We're trying to communicate the best safety for our children and our elderly. We had people in nursing homes dying left and right. We didn't know what we were doing. That's fine. But that has nothing to do with the fluoride in Lynden. The fluoride in Lynden is perfectly fine. I agree on everything you're saying with COVID.
But it has to do with government-funded research. And the research that you're using to quote your case is directly tied to the same government that fooled us about COVID and dropped the ball on COVID. That's my opinion on that.
But everything that I'm saying is backing up the fluoride has been in the government since the 50s. So multiple administrations.
They lied to us about JFK. I mean, they lied to us. I'm serious. You know, just because it goes back into the 50s, which I do believe we had a more honest period. But, you know, once it got into the 60s, things started changing, man. I mean, I'm going back now, finding all kinds of things about our government, our CIA, our FBI.
Sure.
There is a ton of stuff that we've been hook, line, and sinker sold and believed that we're finding out is not true. The problem is nowadays for those who have had a dog in the hunt to keep us taking certain things, doing certain things, is with modern technology now, you can't hide it for very long. The truth is going to come out.
I agree.
And that is why Google, Facebook, YouTube, at one point, Twitter, all scrubbed people, canceled them, blocked them, called it misinformation, disinformation. You go to Rumble, you get a whole nother look. You get all this information. The question goes back to, if they're telling the truth and there's nothing to hide, why not let people... it's freedom of speech, you know, and our government now would call anything against COVID that doesn't meet what the CDC said misinformation and disinformation. And there's doctors coming out now and saying, hold the horn there. We've been lied to. And even doctors that were for it at first are going, no, this is wrong. There's a lot of us that already suspected that and said, hold the phone. But no, we've got to shut down the government. We've got to, you know, although strip joints can stay open, but we got to shut down churches. I mean, come on.
I know.
Look at the idiocy in that. So, and I'm not trying to be hard on you, but you tell me, trust this government study. I don't trust the government as far as I can throw them. So whenever I see a government study, I'm going to look at all the other naturopathic guys that are doing their own studies, and I'm going to weigh that in the balance, and I'm still going to come to the conclusion that I don't think I want fluoride in my water.
Can I give you my opinion?
Absolutely. I want to hear it.
Those naturopathic guys. They are awesome salesmen. A lot of what they do, they know people don't know the level of science background like I have, so they could create a boogeyman. Like a long time ago, it was mercury fillings, amalgam, silver fillings. That was one of their first things where they said, this is dangerous. The government's lying to you. You could be hurting yourself. And they made a business out of selling the treatment option to replace your silver fillings. Mainstream dentistry says that's all a hoax. There's no evidence for that. They're doing that as a sales pitch. And they're really good at selling that. They can convince people because it's questionable. The layperson doesn't know. They hear the word mercury and they're, ooh, mercury, and they're afraid of it. But a dentist can explain to you why it's not to be feared.
But I don't think
Just
that's...
like I could say
I think,
fluoride's not to be feared.
I think that's shifting, though, Jonathan.
What do you mean?
I don't have to be a doctor to get online and start doing my own research. In fact, I was in my doctor's office one day. It was an older doctor. I'm watching this guy who's supposed to be the expert that went through school Googling something about the question I asked him.
Sure.
And I'm like, people go, well, trust the experts. Define an expert these days. I can do a search online for 5 minutes and find out just about everything we've talked about today. So, you know, that's shifting. It's no longer trust us, we know it's best. No, there is nutritional health out there. The nutrition, we even talked about it earlier. The nutrition you put in your body has a huge effect with what goes into your mouth and your teeth and your gums. Doctors are a pill for every ill. I had a pharmaceutical rep who was a friend. He told me, we tell the doctors, we tell them what to give their patients. We give them samples, they try it. Now, not all doctors. There's some doctors that go out and do their own work.
Right.
I have a good doctor now that she's in the medical system, but she'll also tell me, hey, there's this really good book on nutrition. Check this out. And she's also not opposed to working with a naturopath because God gave us naturopathic medicine and gave us the elements in the earth and the elements that we have. And so there's plenty of evidence out there. I follow a guy named Gary Brecka. He's a great health coach. Yeah, does he sell stuff? Absolutely. Who doesn't? Government sells us crap all the time.
I don't.
Well, I'm not saying you do. I'm getting back to your point of trusting the government again and what a doctor and a dentist says based off of what your detractors would say, indoctrination. You're saying that they're buying a sales pitch. I've changed lots of things in my life that are different from what the doctor told me. And I've seen, in fact, I'm taking some supplements that help my blood pressure and it's gone down.
Perfect.
So to say that naturopathic medicine is just trying to sell you a sales pitch, I would have to disagree with that.
I didn't say medicine.
Okay, maybe I miscorrected.
Dental. If you
naturopathic dental.
If you call yourself a naturopathic or some kind
I misread
some
you.
kind of special dentist that has special knowledge that nobody else knows, he's selling you something.
Well, if he's saying that I've got something, yeah, gotcha. Okay.
Yeah.
Fair enough. I snuffed that out right away. It's like, I've got this special thing that you've got to check out. And for $29.99, you can find out. Press. Yeah. If they're not telling you, I'm talking about information that everyone has access to. So, okay, I misunderstood you. So you're not against naturopathic stuff. You're against some guy saying, I got the solution above everyone else. You got to come see me and me exclusively.
Especially if they're against fluoride. Any dentist, listen to me, bro. Any dentist who is against fluoride at the level we have in Lynden, Washington is number one, exaggerating. They're scaring you. They're trying to they're trying to convince you that it's bad so that they could also convince you that these other things are bad, and they're going to sell you the solution.
And what's
fluoride in the water is easy to trick people.
So what's the dog in the hunt for them? What do they get out of that?
They make money selling their treatments. I don't make money selling special treatments.
Well, it's a capitalist country. What's wrong with doing two things? Telling the truth about it and making money on it.
If you're lying to convince somebody to sell them a product, I don't believe that's
So are you familiar with this guy,
accountability.
Griffin Cole? He's in the National Academy of Oral Medicine Toxology. He's in that, right? So
he wrote a letter.
So you think this guy's a liar?
He wrote a letter to the editor of the Lynden Tribune, and that's what got me involved because I saw his face saying Lynden water's bad, and I said, nope, I'm going to respond to that.
So what's his lie? What is he selling that? What's his gain?
He's all over YouTube. He goes around and does conferences. He teaches people.
Awesome, good.
He teaches other dentists how to sell what he's selling.
Yeah, but that's your opinion.
I don't even know if he practiced dentistry anymore. I think he's a naturopath, but I don't know.
There's a lot of guys that retire and go around and give seminars. That doesn't change the fact that their information's valid or not.
He's one of maybe 5 dentists in America that are doing that.
They've got 1,500 now.
They have members that are part of his club that he's trying to grow or whatever, but that's not mainstream at all.
Okay. So you're saying that what he's... I'm not sure I agree with you that he's pitching something to make money as a dog in the hunt. I see how you could think that, but...
The ADA and dentists like me who don't do this to make money or sell products or sell new treatments or sell information that we say is the newest stuff, we would look at him. They used to say that's snake oil. They used to say that's charlatan. They used to... I'm not going to say that. I've never met him. He might be a great guy. I don't care. But I'm saying from my point of view, when somebody tells you that there's a boogeyman and they have the solution to fix that boogeyman problem, to me, that's a snake oil
Yeah, I get
salesman.
what you're saying, but that I watched his interview. I don't get that from him at all, and I'm not a stupid person. Maybe I need to do more research on him. Maybe I'm missing something that you're seeing. But I think we're coming from two different sides again. You're coming from the ADA.
Sure.
I'm coming from, I don't care who it is. I want all the information I can get.
Mm-hmm.
This guy's been doing it for 30 years. Whether he's retired or not is irrelevant to me. He's not dumb. I haven't seen what he's making money on or not, but he's still said he alluded into the video. He's still got to practice, and he's not having the issues with cavities like he's supposed to. Not Florida. He uses,
That's one dentist making that claim.
Well, what's the old saying? 4 out of 5 dentists recommend fluoride. Well, I want to know what that one dentist is saying. Why is that one dentist not with the other 4?
Sure.
That's a red light bulb for me. And people gloss over that. They just accept that. Oh, well, 4 out of 5 say, well,
Yeah.
well, what about the 4th one?
Yeah.
Why does he not agree? And that's before anyone had a dog in the hunt or was doing YouTube videos. That's just been an old saying forever.
Right.
And so what I'm saying is there's also a case for the other 4. Right. Okay. That's cumulative evidence. These are
Sure.
But then your detractors would say, well, they're part of the system too. So, I mean, we can get into the weeds of that. The point I'm making is, and this is why we're having this conversation, because these are a lot of things I think people wanted to ask you.
Yeah.
Which again comes down to, is there enough evidence, that convincing evidence in light of the potentials of toxicity and cumulative effect to bother spending tax dollar money to put fluoride in our water? I'm not seeing it. I don't have the schooling you do, but just from what I am seeing, I would rather just have Bellingham as clean. They don't have a higher rate now of cavities. Ferndale, there's
Wait a
other
minute.
places.
Yes.
What's that?
Yes, they do. I see it every day.
That people from,
Absolutely.
right, but that's your opinion of what you're seeing.
Me
You don't
and
know that they're drinking the water or not.
Me and 15 dentists that I work with see these kids and these adults every day. If you're not from Lynden, we know it.
But what's your test?
How many cavities you have? I see people for checkups.
Hold on. You're not understanding my question. What is the study? You say you see
Yep.
people coming in with cavities, okay?
Yep.
But they could be coming from anywhere. And how long has there not been fluoride in the water?
In Bellingham,
Right.
I don't think they've had it at least 20 years. I don't know if they've ever had it.
So you would need to see whether Bellingham would have to have fluoride in the water for a period of time for you to be able to see if there's a difference or not, right?
They've done that. Not in Bellingham, but I could give you lots of examples. You want to hear one?
Mm-hmm. Yeah.
Juneau, Alaska.
Mm-hmm.
They had fluoride. Their city council stopped it. This was in like 2012.
Mm-hmm.
One college researcher lady who wasn't part of the government at all, she's a professor, she said, I'm going to see what happened after they stopped the fluoride. And she all she did is collect data on these kids that had Medicaid, the low-income kids, and we could see before the fluoride, how much money did they spend on their dental care? 5 years later, after the fluoride, the same group, that age group of kids, how much money did they spend? Taxpayer dollars. How much money did we spend on fixing cavities? She calculated the average per kid per year was over a $250 increase per child. And that's taxpayer money that we wasted because we stopped the fluoride. What's the point? And they could compare it to Anchorage, Alaska, which didn't stop their fluoride, and their cavity rate stayed the same. Their increase in cost basically followed inflation. Went up a little bit. Juneau went, whoop. It's
So-
easy to measure.
Okay.
Example number 2,
Yeah, go ahead.
Calgary, Canada versus Edmonton. Edmonton had fluoride, continued their fluoride. They could measure how many kids had cavities. It's like 50% of all kids, right? Calgary, they could measure how many kids had cavities. They stopped the fluoride in Calgary, and they measured what happened to the kids with cavities. And they could compare it to Edmonton that never changed. Calgary shot up. And this is cavities. They're measuring, looking at the kid's teeth. How many cavities does this kid have? So in Juneau, they calculated how much money they're spending on fixing teeth. In Calgary, Edmonton, they're calculating how many kids have cavities. And they could compare it during that time period.
And who is the study done by? It was a government study?
No, it was an independent person in Juneau. It was a lady who worked for the University of Alaska Anchorage or something like that, and she got her paper published because she said, I want to see what happened.
Interesting.
And in Windsor, Ontario, Canada, in 2013, they stopped their fluoride. And then they did some research on emergency room visits on kids with toothaches and infections before and after the fluoride change. After the fluoride change from like 2013 or whatever, 2012 to 2016, there was a 50% jump in emergency room care for children with toothaches and painful infections. And then Windsor said, "Fuck this, we're going to change it back." And they got their fluoride back.
And then
That's
what
how
happened?
they make these decisions.
Did it go down?
That was in 2022. I don't know if they've...
It'd be interesting to see the study now to see if it went down.
Yeah. But that's the type of results that are tangible. A lot of what you're talking about is theoretical. This could be bad theoretically. It could be changing IQs. It could be hurting your pineal. But when you actually look at the tangible,
we're gonna see on some of this
population level data that we see with toothaches and cavities and money we're spending, it's real results. Like these are the reasons we make these decisions. And that's why they started it back in Grand Rapids, Michigan in the 40s, because so many people had cavities. And they saw this town in Colorado that didn't have cavities. And they figured it out. It was just the fluoride in the water. All we need to do is adjust the fluoride in the water a little bit. We could prevent so much suffering. And that's what I do for my job. I prevent suffering. Those kids, I mean, why would we do it? If we take it away in Lynden, all you're doing is taking away protection that's a protective layer that's part of brushing your teeth, part of taking your kid to the dentist, part of eating good, healthy food, part of being smart with your health, part of doing everything else we do. But if you take away that fluoride, that's the basic foundation of our public health policy for teeth. And you lose that protection. And you're going to take it away because you're theoretically worried that it might be an issue. And you say choice, freedom of choice. Why would we do this to ourselves? Why is the government doing this again? Why is that freaking government doing this to us again? For me, it's not a choice. All we're doing is adjusting the parts per million a little tiny bit. It's a natural occurring thing already. All we're doing is tweaking that little natural amount. We're not giving you poison. The toxicology, we're not to the level where it's harmful. We're still in this safe range.
Well, again, I think that's still left, that there's going to be more studies that are going to determine that. This lawsuit is, I love your passion about it. I truly believe that you believe this.
Yeah.
And I respect that.
Thank you.
I do. No, I really do. And the reason I wanted to come in and press you is I'm still not convinced. That's okay. We can still be friends because I like you and I think we agree on a whole lot of other things. So.
Hell yeah.
But I mean, I wanted to give the people a chance to press back a little bit and say, I have a couple questions too from people that have sent in. I haven't really looked these through, so I don't know how good these are, but let's see a couple let's see, what is this one? I don't know. Why is the burden of proof on us that fluoride does not cause thyroid osteoporosis, cataracts, Alzheimer's, pineal gland issues, ADHD, impacts the brain development in the fetus? Yeah, mother's milk. There's concerns about that.
Right.
Where are these studies and for what age and different body chemistries?
Everything that I've read on the studies shows with any of those issues, there is no proven cause and effect. They have associations. They usually say there's a link or there's an association, but that doesn't mean the fluoride's leading to that issue. It just means you have a large group of people that on average drink this much fluoride. And at the same time, in that group of people, you have an average, this amount of people has hypothyroidism. That's all the study says. It doesn't say the fluoride level caused the hypothyroidism. It says there's an association.
So what if we find out that in another 3 or 4 or 5 years that actually was the case and we didn't stop it?
They've tested this stuff on animals. Give a rat this much fluoride, give them more, give them more, give them more. What happens to your thyroid? They can measure that in animal studies. And that animal study
have they done it on pigs? Because pigs are more like humans. I don't trust rat studies, quite frankly. Rat studies, rats are rats. They're like cockroaches. They can adjust a lot of stuff that humans can't. So I'm a little skeptical on the rat studies. You'll have to excuse me on that one.
But pretty much it's all inconclusive. They always say the level of fluoride we have that we're ingesting has never been linked, never been proven to show harm.
So what you're saying...
increase it, it does.
So what you're saying, so if I understand you correctly, is again back to the studies that you know currently there isn't enough evidence for you yet to say that.
Right.
Okay. Fair enough.
And they have government agencies that analyze hundreds of studies, whatever, everything. They combine all of these results, and those guys get paid to say, this is real, this doesn't matter, this is wrong, this is biased, this is funded by somebody. And they combine all that stuff, and they give us dentists guidance.
Well, again, using the government isn't exactly the best for the other. Your detractors
Who else would do it?
There's independent contractors, you know.
Not to that level of sophistication.
Yeah, we're going to see with this study that's coming out by the, you know, I think that there's.
I do know of one independent organization that are called National Sanitation Foundation, NSF. Have you ever seen a chemical? NSF. Yep. If you got the NSF seal of approval, that's not government. That's an independent group. They are the ones who check our fluoride that the city of Lynden uses for safety. They're making sure there's no lead, there's no arsenic, there's nothing wrong with it. That NSF seal of approval is an independent thing that double checks stuff.
Speaking of three-letter agencies, the EPA has not even approved fluoride for supplemental use. Did you know that?
Doesn't have to. It's not its purview. The FDA does. The EPA.
Sorry, the FDA.
Yeah, because
the
supplements.
FDA hasn't either. That's what I meant. Sorry, I misspoke. The FDA, Food and Drug Administration, has not approved fluoride for supplemental use.
You know why? They don't approve supplements.
I know.
Any supplement is going to say this has not been approved by the Food and Drug Administration. So fluoride supplements, they don't approve any supplements. Why would they approve a fluoride supplement?
Right. Well, I think because I would think because of the potential toxicity concern.
They do approve toothpaste and pharmaceutical level stuff. They have to, because that is a concentrated dose. And they know that concentrated dose, like I said, has the potential to poison you. You have to get the FDA seal of approval at a certain concentration. At a fluoride supplementation, nope. At fluoride in our water, nope. It's not dense enough to hurt you.
You mentioned lead. There was a question here.
Yeah.
We know fluoride pulls lead out of pipes, thus disproportionately impacts the lower income homes. Why should we not be concerned?
I've never seen science to back up anything about lead in our pipes related to the level of fluoride.
Well, everybody, go to your keyboards, start looking. Well, I bet you're going to get some emails about that one. I don't know. I'm just asking the question. Yeah. So,
do we even have lead in our pipes?
I don't know. That's the question. I have somebody that works in Lynden that would know that. I'll have to ask him if
Public Works Director.
I would think, I would think our pipes are probably more updated. Lead pipes are going to be in much, much older.
Yeah. Oh yeah.
I would think. Yeah.
I think the lead pipes issue is more about the lead pipes being dangerous than the fluoride causing anything. And I've never heard of any science to say the fluoride is reacting with the lead somehow. So I could look that up more.
Sure. I don't either. I mean, asking some questions on that end of it. Sure. Our understanding of science changes over time. We would put mercury on teething babies, spray DEET on children at school and in their food, and doctors would at one point recommend smoking. I never heard that. Various drugs have been taken off the market after too many adverse events.
Absolutely.
Through all of these, few brave doctors started speaking out that they weren't safe. Do you believe, I guess it just goes back to what I was saying earlier, do you believe in some of these alternate researches, or do you just go back to whatever the ADA says or whatever, you know?
The reason we stop doing drugs is because the same government agencies research it thoroughly and they decide the evidence is there to stop. We're not going to do DDT anymore, whatever that stuff was for mosquitoes, because we figured it out. And if you're going to say the whole U.S. government changed their mind because one or two researchers that were alternative somehow figured it out, but the government didn't. No, it's the same government people that are deciding these things. I think they do the studies. They figured out that those agencies exist to protect us. They have integrity and they have a mission. I firmly believe in everything they say about fluoride. I have no qualms with what they're doing based on these other things, because in the past we were wrong. We were wrong about lots of stuff, but we've never been proven wrong about fluoride.
Well, we can agree to disagree on that. That I think that the point they're saying is there's new evidence, there's new science, and I think that's going to change soon. There's a shift, but I don't know, maybe not. Again, for me,
Yep.
it just goes back to I'd rather not. Let me decide. Let me decide how many
Absolutely.
And I don't think you're. I mean, if Lynden takes the fluoride out of the water, it's not like you're going to be protesting on the street going, put it back in. You're not that kind of guy. You're going to let the cards fall where they may, and you're going to do your job.
Here's what I wish we could do. The city of Lynden has a city council that happens to be the guys who get to vote on this. Why can't we say, city council, change this process so you let the citizens vote on it? What if
That's a good idea.
What if 80% of the people of Lynden believed in it and said it's good and we want to do it? Shouldn't 80% of the city of Lynden get that?
Well, I think it's a good idea in any democracy,
Right.
or republic, really. But is put the vote back to the people. That's what these initiatives are that we vote on all the time. So long as it's both sides are shown. The pamphlet shows it. Here's what this side says. Here's what this side says. No, I think that's a great idea.
I would have
Jonathan.
no problem with that.
Yeah.
The last time we elected these guys, they all ran unopposed. We have volunteers. We don't even have an election. We have volunteers.
I think that's
I love them. I love the guys. I love them. I met all of them.
Right.
They're great men.
Yeah.
But honestly, for the fluoride issue, I just wish they would follow the guidance that we receive from the state of Washington Department of Health, from the federal level. The Whatcom County Department of Health fully backs fluoride. Just listen to the guidance. You guys don't have to figure this out.
Well, I think that's where we're going to agree to disagree. I think that there's enough alternate studies that are raising enough red flags for people to say fluoride's not essential. You can get treatment yourself. Toothpaste isn't that expensive, and it's a much higher dose, and topical works better anyway. So let's not risk crossing the blood-brain barrier and having the cumulative effect. And let's wait until some of these more studies are done. Give us clean drinking water. If you want to do fluoride, do it. It should be up to you. Just give us clean. And I think at the end of the day, that's what the detractors are saying. I get what you're saying. And, I'm not as much of an expert at all at this, but at the end of the day, I like your idea about really letting the people, but in a way, by the city council doing that, people do have a choice then to go get fluoride treatment if they want.
They should do both.
Yeah. Well, there's definitely opinions on that. I love your passion.
Yeah.
And, hey, Jonathan, man, thanks for coming in. I mean,
Hell yeah.
This was great. I mean, I don't know that I agree, and that's fine. But you had some good points.
Thank you.
And I wanted to give you the chance to have a little pushback. I don't know if I did as good. I'm sure there's people going to send me stuff. You should have asked him this and you should have asked him that. And I'm like, well,
No, I think you did fine.
For me, the point is cumulative effect, topical is best. You want a fluoride, you do it yourself. Keep it out of our drinking water. Jonathan says it's safe. He says, you know what, there's studies that show that it saves other hospital bills from toothaches and tooth decay and different things. I think we're just going to have to keep doing our own research, and which thank God we have that ability to do our own research, and we can agree to disagree. Jonathan, anything else, any last thoughts about, I mean, like I said, you're a reasonable guy. I think the reason you got on there is honestly believe you're passionate about this, and I believe that you believe what you're saying, and I respect that.
Thanks. I mean, the last thing I can say, I've only been doing this to put out information.
Right.
I just want people to have the truth. I want people to know this is what the establishment dental community believes based on years and decades of studies, and we've tested it, and it's not, if I'm indoctrinated, then you shouldn't listen to anything I say, right? Why would you go to a doctor or dentist at all? If I'm going to tell you how to fix your teeth, and I can, but you think I'm indoctrinated and you think everything I believe is wrong, why would you even come to me? Go fix it yourself. I mean, I don't want you to do that. I want you to trust me. I want you to believe in what we got to offer.
I think the answer they would say to that is I think that you've been convinced by your indoctrination, while other dentists who were indoctrinated early on have stepped out of that indoctrination, realizing there's new evidence and alternate evidence that they're researching. I think that's what your detractors would say. And they may not go to you anymore. They may go to their other doctor. That would be my argument. So, but you do have a good point. Is like, then why would you come to me if I got one thing wrong? Do I have 10 things wrong?
Yeah.
Right.
I don't know.
That's kind of what you're saying, right? Yeah.
Kind of. I mean,
Yeah. Okay. Fair enough.
The other thing is, just as a dentist, I give people options. I inform them of things and I let them decide.
Yeah. You're just not throwing it at them like.
Yeah. I have no problem with people who come to me and say, I don't want fluoride. I say, that's great.
Right.
But I need you to know this about what you're eating. You got to take care of your diet. I need you to know this about your brushing and flossing. I need you to know this about how often I recommend for you to come see me for cleanings and all this stuff and x-rays, because we can help you take care of yourself. That's really what we're doing. So
no, that's good.
As a health professional, that's all I'm doing. So
no, I believe you. I believe that you'd believe this, and whether we agree on everything or disagree, I think that this was a good little debate interview. I said, like I said, I'm not an expert on this, and I'm sure I'm going to get mail about, well, you should ask this, you should ask that. But for me, again, it wasn't so much the what, the why, and I think we've kind of covered that.
All right.
What would you, just a couple of since I got you here, what kind of dental floss do you recommend? I mean, some people do that scented, flavored, waxy stuff, but like, what would you recommend?
There's so many different things. They got the little picks. They got the tiny little brushes you can go in between. The regular old school string. It kind of depends on how nimble you are with your fingers. If you know how to wrap it around your fingers and you're actually doing it right. Those little brushes with the little, they got a little piece of floss right here with a handle and you can just pop them in. Those are handy. Just kind of depends on what you like to use. It's comfortable and your finger dexterity lets you do a good job.
Okay.
You don't just want to go pop, pop. You want to go rub it and go in and out like a circle, circular motion. Get that surface really squeegeed.
What about the water pick toothbrushes that shoot the water?
Those are great.
I got one of those and I love it, especially after you eat popcorn.
Those are awesome.
I go back there and it's like, what the heck is all this stuff in that was in my teeth?
Yeah, that's fantastic. A lot of patients nowadays are doing the water pick. So yeah.
Well, it's easy and it gets, when I first started doing it, my gums bled a little bit. Now they're not, right. I had some, what is that when they bleed like that? Is it just gingivitis? Oh,
it's inflammation.
I'm going to cut that part out. You didn't hear that.
Yeah. But as you clean it more often, the bacteria in that gingiva gets flushed out and the gingivitis shrinks.
I love
down.
my water pick. My teeth, my mouth feels so much better. It's just, What about teeth whitening? What about peroxide, toothpaste, and baking soda, that kind of thing? Yay, nay?
A lot of it works if you do it consistently, and you might get a little bit of sensitivity because the peroxide does make your surface more porous. So I tell people to maybe try mix in some sensitive toothpaste. Or actually, the best toothpaste for it is high fluoride. But
why so? What does the fluoride counteract it somehow?
Yeah, it rebuilds the surface.
Okay. Well, and again, there's people that think it's toxic on any level. I'm not so sure I'm convinced of that.
Right.
Okay. I do a fluoride toothpaste, like you said, and don't swallow it,
right.
Be responsible.
Yep.
The people say, well, it can get in your bloodstream through your tongue and stuff. It's like, well, that's something you're going to have to weigh. Again, I'm not so hardcore on this. For me, it was more about just having the choice to have it in the water or not. But anyway.
My knowledge on the subject of your body absorbing fluoride through your skin doesn't happen.
Okay.
The only way you get fluoride into your bloodstream, your stomach
ingestion.
Your stomach has a special pump channel. When the fluoride ion in your stomach acid combines with an hydrogen, then it's able to cross through that channel. It cannot enter your bloodstream any other way, through your epidermis or your mucosal surfaces inside your mouth. The only way you're going to get it in your body is if you swallow it. And nobody has to. You can brush your teeth and spit it out.
Sure. And the average person that has decent teeth, how many times a year should they come see you? Or how many times in their life? Because I haven't been in a long time.
Some people go for years and years and years. a normal, healthy person with low risk for gum disease or tooth decay, I tell them once a year is good.
Okay. Yeah. That's fair enough. Honestly though, I had a friend of mine, his wife was a dental hygienist, and Jonathan, I just got to say, I'm embarrassed, but I was kind of happy. I haven't been to the dentist in probably 30 years.
Yeah.
I went in, she says she was shocked at how good my teeth were. And now, I did have fluoride treatments. So I'm going to be fully honest, people, whether that helped or not. I did have, when I was younger, my mom, she bought into the fluoride thing, and maybe it did. I mean, there's evidence that it helps. I'm not going to lie. There is evidence that it helps your teeth. So let's be honest. But I'm very fortunate. I think a lot of it's hereditary, and I taking good care of my teeth. But she said, how do they number it, like 1 to 4 on how bad or something? It was a number system. She said most everything was 1s and 2s.
Was she measuring your gum pockets?
Something like that, where she'd measure how bad the whatever was in my teeth, and maybe that's what it was. And she said you only had one that was like a 3.
Cool.
Everything else was 1s and 2s, which isn't bad for somebody who's been to the dentist in 30 years,
That's perfect.
So I'm gonna.
You're doing good.
Well, Jonathan, thanks again. So good to have you. And the last question is Trump or Biden? No, I'm just kidding. We'll talk about that. We'll talk about that off air. There's plenty of opinions about it. Thanks again for coming in, man. I really appreciate it.
Absolutely.
Folks, I know you're going to send me all kinds of email about I should have asked him this, I should have asked him that. I think I covered about a lot of it. Whether you agree or disagree, keep doing your own research. And you know what? You can stand up at county council meetings or city council meetings and you can say your piece.
Yep.
I think Jonathan's a great guy. I don't think he's so hardcore that he's going to, stand on the street and march out there and say, you guys screwed up. You didn't put fluoride in your water. I think, and again, your point about, bringing it to a vote would be just as good as well. I think you're a fair guy and I appreciate you coming in. Jonathan, thanks again.
Thank you.
All right, everybody. Thanks for tuning in. I hope that was informational. I am your host, Mark Urban, and this is the Urban Outcast. Until next time, see you guys later.